Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Sarah about acoustic neuroma. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hi, it's Sarah, isn't it?
Yes, that's right. Hi, Dr. Martin.
I haven't seen you for a while. How have you been doing, and what brings you in today?
Yeah, I've been meaning to come in for a checkup. Lately, I've been experiencing this constant ringing in my ear for a few weeks now, and it's getting a bit annoying. I thought it might just go away on its own, but it hasn't, and I just want to know what's going on.
I see. I'm glad you came in. Let's try to get to the bottom of this. When did you first start noticing the ringing in your ear? Do you recall any specific incident that might have triggered it?
I think it's been about a month now. It started off really faint, like a barely noticeable hum, but now it's become pretty constant and loud enough that it's hard to ignore.
That sounds frustrating, Sarah. Constant ringing in the ear, known as tinnitus, can be quite bothersome. Have you noticed any other symptoms accompanying the ringing, such as dizziness or trouble with your balance?
Yes, actually, I have. I didn't think much of it at first, but I've felt a bit off balance lately, especially when I'm walking. Sometimes I get these sudden bouts of dizziness that make me feel like the room is spinning.
It's good that you mentioned that. Feeling off balance and experiencing dizziness could be related to what's happening with your ear. Have you noticed any changes in your hearing or a feeling of fullness in that ear?
Now that you mention it, yes. My hearing in that ear hasn't been great recently. It's like everything sounds muffled sometimes, like I have cotton in my ear. It's been really frustrating, especially when I'm trying to have a conversation or listen to something important.
That sounds concerning, Sarah. Have you ever experienced any pain in your ear or headaches?
No, I haven't really had any pain in my ear. But I do get headaches more often than I used to, especially in the last few weeks.
Headaches can sometimes be linked to ear issues, especially if there's something affecting the inner ear or the nerves connected to it. How has your general health been otherwise? Any recent illnesses or stress that you think might be contributing to these symptoms?
Well, I had a cold a couple of months ago, but I don't think it's related. The cold wasn't that bad, just the usual sneezing and stuffiness. But I have been really stressed with work lately. The long hours, tight deadlines, and constant pressure are really taking a toll on me.
Stress can indeed have a significant impact on your overall health, and can sometimes exacerbate symptoms like the ones you're experiencing. But with the combination of symptoms you're describing, particularly the ringing in your ear, balance issues and hearing changes, There's a specific condition called an acoustic neuroma that we might need to consider.
Acoustic neuroma? What exactly is that? It sounds serious.
It's understandable to feel concerned, Sarah, but let me explain. An acoustic neuroma is a non-cancerous growth that develops on the vestibular nerve, which connects your inner ear to your brain. This nerve plays a key role in both hearing and balance. When a growth like this occurs, it can cause symptoms like tinnitus, hearing loss, and balance problems, which seem to match what you've been experiencing. Although it's a rare condition, it's important to investigate further to rule it out or confirm it.
Wow, I had no idea something like that even existed. What do we do next? Is there a treatment for it if that's what it is?
The next step would be to refer you to an ENT specialist for a more thorough examination. The specialist will likely perform a hearing test to assess the extent of any hearing loss and may recommend an MRI scan to get a detailed image of the area around your inner ear. If it turns out to be an acoustic neuroma, the specialist will go over the treatment options with you, which can vary depending on the size of the growth and the severity of your symptoms.
That sounds a bit overwhelming, but I'm glad we're looking into it. I just didn't expect something like this when I came in.
It's completely understandable, Sarah. These things can be worrying, but the important thing is that you're taking the right steps by getting it checked out. We'll take it one step at a time, and I'll be here to guide you through the process. I'll make the referral today, and we'll get you in to see the specialist as soon as possible.
Thanks, Dr. Martin. I really appreciate your help and support. I'll do my best to follow your advice and stay positive.
You're welcome, Sarah. We'll get to the bottom of this together and confident we'll find a solution that works for you.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Miss Collins regarding acne. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Ms. Collins. I'm Dr. Reynolds. I see you've come in today about your skin. Can you tell me what's been going on?
Morning, doctor. Yes, I've been having a really hard time with acne lately. It's been flaring up a lot more than usual, and nothing I'm doing seems to help. I'm feeling really frustrated.
I can understand how frustrating that must be. How long have you been dealing with these flare-ups?
It started getting worse about 3 months ago. Before that, I used to get the occasional pimple, but now it's like my whole face is breaking out. I've got a lot of painful spots around my chin, jawline, and even on my back.
3 months of worsening acne, that's quite a while. Have you noticed anything that seems to trigger the flare-ups or make them worse?
Well, I think stress might be playing a part. I've been really busy at work, and I've noticed that the acne seems to get worse when I'm stressed. But I've also been trying different skincare products to see if they help, but they either don't do much or seem to make things worse.
Stress can definitely contribute to acne, and sometimes switching products too frequently can irritate your skin further. Have you tried any specific treatments or medications for acne?
I've tried over-the-counter creams, like benzoyl peroxide and salicylic acid, but they haven't made a big difference. I also started using a new face wash that's supposed to be gentle, but I'm not sure if it's helping or not.
It sounds like you've tried a few things, but without much success. Sometimes over-the-counter treatments aren't enough, especially if the acne is more severe. Have you ever been prescribed medication for acne in the past?
No, I've never had to go on prescription medication before. My acne was never this bad. But now I'm starting to feel like I need something stronger.
We have a few options that might be more effective for you. Depending on the severity, we could start with a topical treatment like a retinoid or consider an oral medication. Sometimes a combination of both can work best. Have you heard of these treatments before?
I've read a bit about retinoids, but I've never tried them. I'm open to whatever will help. I just want to get my skin under control again.
Retinoids can be very effective in treating acne. They help to prevent clogged pores and reduce inflammation, but they can also cause some irritation, especially when you first start using them. I'd recommend starting with a lower concentration and gradually increasing it. We could also consider an oral antibiotic if there's a lot of inflammation and if the acne isn't responding well to topical treatments.
I'm willing to give it a try. Would I need to be on these treatments long term?
It depends on how your skin responds. Typically, we'd start to see improvements within a few weeks, but it might take a few months to see significant changes. Once your acne is under control, we can gradually reduce the treatment or switch to maintenance therapy. It's important to be consistent with the treatment and patient with the results.
Okay, that makes sense. Is there anything else I should be doing in the meantime to help my skin?
There are a few things that can help. Try to stick to a gentle skincare routine, avoid harsh scrubs or over-cleansing, as these can irritate your skin further. Moisturizing is important, too, even if you have oily skin, as it can prevent dryness and irritation. Also, try to manage stress as best as you can, and keep an eye on your diet. Sometimes, certain foods can exacerbate acne, though this varies from person to person.
I'll try to keep that in mind. I've been trying to cut down on dairy because I heard that it can sometimes make acne worse. Do you think that could be helping?
There's some evidence that dairy, especially skim milk, can contribute to acne in some people, but it doesn't affect everyone the same way. If you've noticed that your skin improves when you reduce dairy, it might be worth continuing. It's always a good idea to monitor how your skin reacts to different foods.
I'll keep doing that. I just want to make sure I'm doing everything I can.
That's a good approach. We'll start with the retinoid and see how your skin responds. If necessary, we can adjust the treatment plan. I'll also prescribe a gentle moisturizer to help with any dryness or irritation. If you notice any severe irritation or if your acne doesn't start improving after a few weeks, I want you to come back so we can reassess.
Thank you, Dr. Reynolds. I really appreciate your help. I've been feeling so self-conscious about my skin lately.
I understand how difficult that can be, Ms. Collins. We'll work together to get your skin back on track. Remember, it takes time, but with the right treatment, we should see some improvement. Do you have any other concerns or questions?
No, I think that covers everything. Thank you again for your help.
You're very welcome. If anything comes up, don't hesitate to reach out. We'll schedule a follow-up appointment in about 6 weeks to check on your progress.
Sounds good. I'll see you then.
Take care, Ms. Collins. Have a great day.
Thanks, Doctor. You too. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor discusses a patient's significant improvement in asthma. Now read the question.
How are you feeling, Miss Taylor?
A bit drowsy, but much better than before. I can breathe so much easier now. I guess the inhaler is working.
That's great to hear. We adjusted your medication dosage, and it seems to be helping your asthma symptoms. You're good to go home now, but remember to avoid strenuous activities for the next few days.
Thanks. It's amazing how quickly this has improved. The last time my asthma flared up, I had to stay in the hospital for almost a week. This is a big relief.
Yes, inhalers can provide rapid relief. Just be sure to use it as prescribed. If you notice any issues, contact us immediately.
I will. It's just hard to believe how fast things turned around this time. I was expecting to be here for much longer.
The right treatment can make all the difference.
Now look at question 26. You hear a nurse educator talking to a group of nursing students about infection control. Now read the question.
When we talk about infection control, one of the key strategies is hand hygiene. It's one of the simplest and most effective ways to prevent the spread of infections. However, compliance rates among healthcare workers can sometimes be lower than expected. This is concerning because infections acquired in hospitals can lead to severe complications, particularly in patients who are already vulnerable due to underlying health conditions. Our hospitals' infection rates are actually below the national average, with only 2% of patients affected compared to around 4% nationally. But to maintain this, we need to remain vigilant. Regular training sessions, accessible hand sanitizing stations, and a culture of accountability are essential in ensuring everyone adheres to the protocols. Even a slight lapse in hand hygiene can result in an increase in hospital-acquired infections, so consistency is crucial.
Now look at question 27. You hear a physiotherapist discusses the rehabilitation plan for a patient. Now read the question.
Today, let's talk about Sarah. She's 3 weeks post-surgery for a herniated disc in her lower back. She also had some nerve compression, which was relieved during the surgery. This is her first time in rehab since the procedure, right?
Yes, that's right.
All right, we're going to start by implementing low-intensity laser therapy on the affected area. The goal here is to reduce the inflammation that's still present in her lower back and to promote tissue repair. This therapy will also help decrease any residual pain she's experiencing and improve her range of motion. Over time, you'll notice a gradual improvement in her flexibility and strength. Our aim is to restore her normal movement patterns without causing any further strain on her spine. Consistency is key in her recovery process, and this treatment is designed to facilitate quicker healing while minimizing discomfort.
Now look at question 28. You hear a medical professional explaining a diagnostic procedure to a colleague. Now read the question.
It looks like Mr. Anderson's wound is healing well after his appendectomy. Has his pain level been manageable?
Yes, he's been comfortable with the pain medication. I'm about to check his vitals before he goes to the ward.
Great. I've ordered some additional post-op checks. He had a slight fever earlier, which might indicate a possible infection. We need to keep an eye on his temperature and watch for any signs of redness, swelling, or discharge from the incision site. His white blood cell count also needs monitoring, so I want you to get a complete blood count (CBC) done twice daily.
Understood. I'll make sure the next shift is aware to monitor for any signs of infection.
Perfect. If anything seems off or if his fever spikes again, contact me immediately.
Will do.
Now look at question 29. You hear a medical professional addresses staff concerns about upcoming changes. Now read the question.
Now, you'll have received the email outlining the proposed changes to our electronic health record (EHR) system. I'm sure you've all been thinking about how this will affect your day-to-day tasks, and it's natural to have concerns. There's plenty of research showing how a more efficient EHR system can reduce errors and improve patient outcomes, which is why this update is crucial. However, I understand that the implementation process can be daunting, especially with everything else on your plate. I want to assure you that we've taken steps to ensure a smooth transition. We've scheduled additional training sessions to make sure everyone feels confident using the new system. And technical support will be available around the clock. Furthermore, we've adjusted workflows to minimize any disruption to your regular duties. Managers will be keeping a close eye on the situation to ensure that everything runs smoothly, so you can focus on patient care without worrying about system issues.
Now look at question 30. You hear a patient talking to a medical receptionist. Now read the question.
Hi, I'd like to book an appointment, please.
Sure. Who is your usual doctor?
Dr. Ahmed.
Is this something urgent?
Yes, I've been having chest pain since yesterday.
I'm sorry to hear that. Unfortunately, Dr. Ahmed is fully booked today, but Dr. Patel is available this afternoon.
I was hoping to see Dr. Ahmed since he knows my history. But do you think Dr. Patel could see me today?
Yes, she could see you today at 3 p.m. Or we could arrange for you to see Dr. Ahmed first thing tomorrow morning.
Well, the pain isn't getting worse, and I'm taking ibuprofen, which helps. Since it's related to a previous issue, it might be best for Dr. Ahmed to check it out.
Okay. Let's schedule you for tomorrow morning at
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42nd, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear a presentation by a pediatric nurse named Jennifer Collins, who's discussing her work with childhood asthma patients. You now have 90 seconds to read questions.
My name's Jennifer Collins, and I'm a pediatric nurse specializing in the care of children with respiratory conditions, particularly asthma. Today, I'd like to share with you some insights into the kind of work I do, focusing on a recent case involving a young patient, let's call him Liam, to illustrate the challenges and responsibilities involved in managing childhood asthma. Before I tell you more about Liam, let me give you a bit of background on asthma in children. Asthma is one of the most common chronic conditions in children, affecting millions worldwide. In the UK alone, over 1.1 million children receive treatment for asthma. It's a condition that causes the airways to become inflamed and narrow, leading to breathing difficulties. Symptoms often include wheezing, shortness of breath, and a tight chest, and these can vary in severity from mild to life-threatening. Early diagnosis and proper management are crucial in preventing severe attacks and ensuring that children can lead healthy, active lives. Now, regarding Liam's story, like many young children, Liam was diagnosed with asthma when he was just 4 years old. His parents noticed that he frequently had trouble breathing, especially after playing outside. Initially, they thought it might be due to a cold or allergies, but when the symptoms persisted, they took him to their GP. After a series of tests, including a lung function test, Liam was diagnosed with asthma. This came as a shock to his parents, who had no history of asthma in the family and were unsure how to manage the condition. Liam's case required careful monitoring and a tailored treatment plan. I first met Liam and his family during one of their visits to the pediatric respiratory clinic. At that time, his asthma was poorly controlled, and he had experienced several flare-ups that led to emergency visits. My role was to help the family understand the importance of consistent medication use, recognize triggers, and manage symptoms early to prevent severe attacks. We discussed the use of inhalers, both preventer and reliever, and the need for a clear action plan in case of an asthma attack. One of the main challenges we faced was Liam's reluctance to use his inhaler. Like many young children, he found it uncomfortable and was often scared. To address this, I worked closely with his parents to find ways to make the process less intimidating. We introduced a spacer device, which made it easier for Liam to use the inhaler correctly, and I spent time showing him how to use it in a fun, non-threatening way. We also worked on identifying and avoiding triggers, which for Liam included cold weather and exposure to pet dander. Another important aspect of managing Liam's asthma was educating his parents and school staff about the condition. Children spend a significant amount of time at school, so it's vital that teachers and school nurses are aware of each child's needs. We developed an individualized asthma action plan for Liam that was shared with his school. This plan outlined what to do in case of an asthma attack, the signs to watch for, and when to administer medication. Unfortunately, despite our best efforts, Liam experienced a severe asthma attack at school one day. The school staff followed the action plan perfectly, administering his reliever inhaler and calling for emergency help. When I visited Liam in the hospital afterward, he was understandably shaken, but we used the experience as an opportunity to reinforce the importance of his treatment plan and to reassure him that he was not alone in managing his condition. Liam's story is a reminder of how unpredictable asthma can be, and why ongoing education and support are crucial. Managing asthma isn't just about responding to emergencies, it's about preventing them from happening in the first place. This involves regular checkups, monitoring lung function, and making adjustments to treatment as needed. For example, in Liam's case, we increased his preventer medication during the winter months when his symptoms were worse, and ensured that his parents knew how to monitor his peak flow readings at home. For me, one of the most rewarding aspects of my job is seeing the positive impact that good asthma management can have on a child's life. Over time, Liam's condition improved significantly. He became more confident in using his inhaler, and his parents became more adept at recognizing early warning signs and managing his triggers. Liam was able to return to playing football with his friends, something he had been afraid to do before because of his asthma. In conclusion, while asthma is a chronic condition that requires ongoing management, with the right support and education, children like Liam can lead full, active lives. As a pediatric nurse, my role is not just to treat the condition but to empower both the child and their family to take control of it, ensuring that asthma doesn't hold them back from doing the things they love.
Extract 2. Questions 37 to 42. You hear a presentation by Dr. Emily Hartman, specialized in cardiology. Now, read the questions. You now have 90 seconds to read questions.
My name is Dr. Emily Hartman, and I specialize in cardiology with a focus on the management of hypertension, often referred to as the silent killer. It's a condition that affects millions worldwide, yet it often goes unnoticed until it leads to serious complications like heart attack or stroke. What's particularly concerning is that hypertension doesn't discriminate. It affects people of all ages, ethnicities, and backgrounds, making it a universal health threat. One reason for this widespread impact is that the symptoms of hypertension are often subtle or even non-existent. This lack of obvious symptoms can lead to delayed diagnosis and treatment, which significantly increases the risk of severe cardiovascular events. In my experience, a major issue with hypertension is the casual attitude some patients and even healthcare providers take towards it. I've seen cases where patients, after being diagnosed, do not adhere to their treatment plans. They may start taking medication but then stop once they feel better, not realizing that hypertension is a chronic condition that requires ongoing management. This intermittent adherence is particularly dangerous because it can lead to sudden spikes in blood pressure, which are more damaging than consistently high blood pressure. Healthcare providers also play a role in this. Some fail to emphasize the importance of lifelong management, instead focusing on short-term results, which can mislead patients into thinking they are cured. Another contributing factor to the high prevalence of hypertension is the lifestyle choices that many people make. The modern diet, rich in processed foods and high in salt, combined with a sedentary lifestyle, is a perfect recipe for developing high blood pressure. Many patients are unaware of the impact that diet and exercise have on their blood pressure. For example, reducing salt intake and increasing physical activity can significantly lower blood pressure, sometimes even eliminating the need for medication. However, this requires a significant lifestyle change, which can be difficult for many people to maintain. The role of stress in hypertension is also often underestimated. Chronic stress can contribute to the development and exacerbation of high blood pressure, yet many patients and healthcare providers do not address this adequately. In recent years, there has been an increasing recognition of the importance of early intervention in managing hypertension. The earlier we can detect and treat high blood pressure, the better the outcomes for the patient. This means that regular screening and monitoring of blood pressure are essential, especially for those with risk factors such as obesity, diabetes, and a family history of hypertension. I've also seen a growing trend towards the use of home blood pressure monitors, which allows patients to track their blood pressure more frequently. This can be particularly useful for those with a white coat syndrome, where their blood pressure spikes in a clinical setting. However, it's important that patients are properly educated on how to use these devices accurately and consistently. I'd like to discuss a case that illustrates the challenges of managing hypertension effectively. Let's take a hypothetical patient, a 45-year-old man named John, who was diagnosed with hypertension 5 years ago. John was initially prescribed a combination of medication and lifestyle changes, including dietary adjustments and regular exercise. For the first year, he adhered to his treatment plan and saw a significant reduction in his blood pressure. However, as time went on, John began to feel complacent. His blood pressure readings were within a normal range, so he started to skip doses of his medication and gradually returned to his old eating habits. Unfortunately, this led to a gradual increase in his blood pressure, but because he felt fine, John didn't see the need to return to his doctor. It wasn't until John experienced chest pain and shortness of breath that he realized something was wrong. He was rushed to the hospital, where it was confirmed that he had suffered a mild heart attack. The heart attack was a direct result of his uncontrolled hypertension, which had gone unnoticed due to his irregular adherence to his treatment plan. Fortunately, John survived the heart attack, but it served as a wake-up call. He is now under strict medical supervision, with a renewed commitment to his treatment plan. This case highlights the dangers of not taking hypertension seriously and the importance of ongoing management to prevent serious complications. In conclusion, managing hypertension effectively requires a combination of patient education, lifestyle modifications, and consistent medical treatment. It's crucial for both patients and healthcare providers to understand that hypertension is a chronic condition that needs to be managed for life. Early detection and intervention are key to preventing the severe consequences associated with high blood pressure. By working together, we can help patients like John avoid the pitfalls of non-adherence and lead healthier, longer lives.
That is the end of Part C. You now have 2 minutes to check your answers.